Hi, everyone. So thank you so much for joining our graduate school panel. My name is Satbir Dillon, and I'm the CAG Students and Young Professionals Network Event Planning Co-Lead, and I'm calling from Hamilton, which is situated upon the traditional territories of the Erie, Neutral, Huron-Vidente, Haudenosaunee, and Mississaugas. I'm also a Master's of Science student in Health Geography at Western. And before we begin our panel, I would like to provide a brief overview of CAGH. So CAGH stands for the Canadian Association for Global Health, and it's a wonderful organization that brings together the Canadian global health community to better achieve a shared goal of improving health worldwide. So the Students and Young Professionals Network, which I and Esther are part of, provides professional development, networking, and learning opportunities through engaging a network of like-minded students and young professionals. To learn more, you can always visit our website. And this is just a reminder that if you have any questions for our panelists, please include it in our chat, and our panelists will answer the questions during the question and answer period. And now Esther, my lovely event planning co-lead, will introduce everyone.
Thanks, Satbir. And hi, everyone. Thank you again for joining us for the panel today. My name is Esther, and like Satbir mentioned, I'm the other events co-lead. And I'm calling you all today from the traditional and unceded territories of the Kwantlen, Katzie, Matski, and Semiahmoo First Nations, also now colonially known as Langley, BC. I am a Master's of Public Health student at the University of Toronto, and I am extremely excited to introduce our three amazing panelists to you. So our first panelist is Radhika Prabhune. Radhika is a French and English bilingual second-year Master's of Health Sciences student in the Translational Research Program at the University of Toronto. And she joined the program in hopes of gaining experience in new fields of research and finding work she is really passionate about. Graduating with her bachelor's from Translation and Molecular Medicine from the University of Ottawa has allowed her to learn about work in the laboratory, working with cells and mice, and analyzing data from a wide array of technology. Her thesis on the effects of cholesterol metabolism on Alzheimer's disease opened her to the field of neuroscience and related psychology. In the future, Radhika hopes to work more directly with people in healthcare, keeping a particular focus on mental health and psychology. Currently, Radhika is also working as a communications assistant with the Translational Research Program, where she helps share the diverse stories of the students, along with volunteer work with the Varsity, which is the U of T student newspaper. She is also involved in many other volunteer initiatives, including being an early reading intervention program mentor at Spruce Court Elementary School, where she helps kindergartners learn to read. Our second panelist is Dr. Sophie Rohr, who is a recent graduate of the PhD program in Social and Behavioral Health Sciences at the University of Toronto. She is also currently a senior research advisor at the Institute for Circumpolar Health Research in Yellowknife in the Northwest Territories. For her PhD, Dr. Rohr worked with Indigenous elder advisors in the Northwest Territories to explore how Indigenous patients and biomedical healthcare providers experience the Indigenous wellness services at Stanton Territorial Hospital. She has worked for over 8 years on a range of community-led research projects, including projects with the Cleachon government and the Governing Council for the Northwest Territories Network Environments for Indigenous Health Research, also known as the NT-NEAR. Dr. Rohr has an MSc in health policy and has global experience working on policy initiatives in Ontario, Yellowknife, Whitehorse, and Uganda. Currently, Dr. Rohr is a postdoctoral fellow at the Well Living House, an action research center in Toronto, where she works on Indigenous-led projects that aim to advance the delivery of care for urban Indigenous people in Toronto. And last, but certainly not least, our third panelist is Aida Bagalu. Aida has a Master's of Science in Global Health from McMaster University and brings with her more than 5 years of extensive consultation experience within the field of equity-based research and services in maternal health, refugee health, global and public health law, and most recently, racism and public health accessibility. Furthermore, Aida has contributed to increased stakeholder engagement and knowledge exchange within a broad spectrum of over 100 government stakeholders, academics, youth, think tanks, community organizations, legal entities, and healthcare service providers across Canada, Europe, the Caribbean, and South Asia. In her current role as project manager with the Western York Region Ontario Health Team, Aida continues to facilitate successful cross-sector engagement initiatives in primary care, patient navigation, and digital health to improve the quality and well-being of several equity-based populations in Ontario. Alongside her role as project manager, Aida also currently serves as the co-editor-in-chief of the Global Health Annual Review Journal, where she spearheads a team of 25 editors and peer reviewers to bridge knowledge translation gaps via open access collaboration with researchers worldwide in the field of global health. Further touching upon her passion for knowledge translation in healthcare, Aida recently joined the methodologists as a consultant in order to help mobilize organizations to design person-centered health services using rigorous research and meaningful engagement while also promoting capacity building to conduct high-quality research. So these are our three amazing panelists today, and if you weren't already excited for our conversation, hopefully by now you are. And with that, I will pass it back to Satvir to get us started and ask our first question.
Thank you so much, Esther. So my first question is, why did you choose your program slash research topic? Radhika, do you want to go first?
Yeah, so I really we got these questions beforehand, so I'm happy to see that question actually. So during my undergrad, you already heard that I was doing a Bachelor of Science. So I was really into like hard medicine or hard sciences, so working in the laboratories, working with cells, working with mice. And I finished my undergraduate degree in 2021. So by the time I had really started working in the labs in 2020, we had just hit COVID and it was just the beginning of the pandemic. So it was quite difficult because at that point, we were kind of staggering who was able to go into the lab. And it was starting to get really lonely just because you weren't allowed to see anybody there. The meetings were all online and we are still just getting used to that. Like we're a little bit more used to it now, so it doesn't feel as bad, but it was definitely a little bit of a kick at the beginning. So I realized that maybe working in the lab wasn't for me. Because I really just enjoyed the time where I was able to speak with people and I was able to talk to my fellow researchers and go to my classes and such like that. So my current program is a Master in Health Sciences in the Translational Research program. So translational research is coming to be a big buzzword nowadays, and this allowed me to kind of open my eyes to a bit of a different style of research because we focus on the people centered in whatever field we're looking at, whatever problem we're looking at. So we don't start with a potential hypothesis about like, oh, we think that this is going to happen and we think that this is the best way to solve a problem. We focus on making sure we're actually looking at a problem that is real and an actual need for the people that we're talking to. And then from there on, we try to co-create as much as we can with our patients or our participants, and then we go forward on that. And then we focus on like a potential solution or an intervention. So that kind of work, it's really gotten my attention because of the ability to use my extroverted nature and talk to a lot of people. And yeah, so it's a very different stage that I'm at compared to my bachelor's degree, but I'm really happy that I got to switch it up a little bit.
Thank you so much for sharing. And it's really interesting how you noted the differences between the hard sciences versus translational research, especially the collaborative approach that you're now taking. So thank you so much. Sophie, would you like to answer this question?
Absolutely. And thank you so much for the invitation to be here today. And it's just wonderful to be able to hear about other people's experiences too in graduate school. While there are a lot of similarities, also a lot of differences. And I love learning about other people's stories. So I'm here today from Takaranto, the traditional lands of the Huron-Wendat, Seneca, and Mississaugas of the Credit. And my journey to the PhD, I think, was I didn't think I was going to be doing a PhD initially. It was kind of unexpected at first, but I was working during my master's degree. I was doing my master's at U of T in health policy and bioethics. And I wrote to a research institute in Yellowknife because I wanted to learn more about Northern health research. I had been up to the north before and had spoken with community members about their experiences in healthcare and was interested in trying to kind of bring together my interest in health policy and bioethics with learning more about the specific challenges or complexities in rural, remote, and northern communities. And I was really lucky that this research institute Institute was able to take me on as a summer student. And I had wonderful colleagues that summer who I learned a huge amount from. And the Research Institute is really community-based. It's based in Yellowknife and has really close relationships with specific elders in the north. And I worked with the Elders Advisory Council that used to be in place at the Health Authority in the Northwest Territories. And at that time, we were working on a scoping review of hospital-based Indigenous wellness center models that would inform the development of an Indigenous wellness center that would be built beside Stanton Hospital. And the elders at that time raised some questions that were really interesting to me. And some of them were like coming to me, they're like, you're going to come back, you're going to keep working with us. And it was really over the next year that I was thinking more and more about these questions that the elders raised and the relationships I built with them. And that's what motivated me to do my PhD. And so then I applied for my PhD at Daulana, and the rest is history. So that's kind of my motivation for the PhD topic. And of course, it's a journey through the PhD program, but I was so fortunate to be able to work with many Indigenous elders throughout the project. And like Radhika was explaining, like my work is also very collaborative and community-based.
Thank you so much for sharing, Sophie. Ida, would you like to answer the question?
Sure, yeah. Thank you so much for the invitation to be here as well. And it's so lovely to hear from our other panelists what their experiences are coming into their roles currently. So I'll start off by saying, may the peace and blessings of God be upon all of you. Thank you again. Thank you everyone for your time, for coming out to this panel and to listening in right now. My story is more personally embedded into a lot of the healthcare challenges that my family faced. So I will start off by saying that as a child, my grandmother repeatedly said to me that not all useful knowledge comes from books. So make use of the time that you have now. And at that time, I was 9 years old. I vaguely understood what that meant. And most of my childhood was spent buried in books, because in my Caribbean culture, that was a path to escaping a poverty-stricken Trinidad and Tobago that I grew up in. So naturally, for almost 17 years of my life, this notion of studying all the time was the way to escape, right? The way to getting that key to success. However, this quickly evolved when I immigrated to Canada in 2016. And during my undergraduate career at the University of Toronto, my mother battled through breast cancer. And witnessing your core role model succumb to the most vulnerable and painful experience of their life makes you reflect on what holds priority and how the systems and societies around you define what priority is. And I quickly noticed that my mother's accessibility to quality healthcare and well-being was not entirely met as a priority, as seen via various discriminatory interactions with practitioners and healthcare administrators dismissing her concerns about follow-up care and continuing care. And this experience was echoed during my master's at McMaster University, when my father suffered a stroke and succumbed to similar challenges that my mother faced. And this was exacerbated further due to the pandemic. And as I reflect on the wise words of my grandmother that I mentioned earlier, as well as the lessons learned throughout these challenges, I strategically situated myself in professional and academic opportunities in healthcare knowledge translation for this purpose of advancing accessibility to quality healthcare and well-being. And I immersed myself in global and public health research. And like Esther mentioned earlier, I'm also working on that publication at the moment. I actually got approved for publication. So that's some really great news. It's racism as a barrier to access to medicines and vaccines in Ontario. So some really cool work in there, and we're defining racism as a form of corruption in this paper. So it's really interesting to see how all of my personal experiences, as well as that of my co-authors as well, have come to play in defining the priority for this research. So that's where my story kind of ended up where I am right now. And I think throughout the time that I was in my master's, I kind of debated on what my thesis topic should be based on the experiences I just outlined. And I directed my attention toward global health law and looking to see how our legal institutions, our legal frameworks have defined what quality healthcare and well-being is. So I'm not sure if some of you might be familiar with this new term, legal determinants of health. So we've heard social determinants of health. Now we have legal determinants of health and what that looks like. So I think my research kind of touched upon defining what that is and looking to see how knowledge translation within the legal sphere has impacted the quality, healthcare, and well-being of refugee populations and other vulnerable populations within Ontario.
Thank you so much, and thank you so much for sharing your personal story. And also, I'm not sure about the other panelists or the attendees, but I've never heard of the legal determinants of health before. So that's extremely interesting. And I would love to ask more questions about it at the end. So thank you so much. Esther, would you like to ask the next question?
For sure. Thanks, Sapphire. So for a second question, I wanted to ask the panelists, what were your biggest challenges, or what was the biggest challenge when you went into grad school or kind of went through the journey of like, so you chose the program that you wanted to do, and then kind of like as you were following through, yeah, what kind of stood out to you guys? So I'll pass it back to Radhika to get us started.
Yeah, so grad school is hard. I think everyone here will agree with me when it comes to that. I think they never, like, they will always tell you that, you know, the next thing you go on to do from when you're transitioning from high school, sorry, to university, and then as you go from university to grad school, they always mention like, oh, you know, it's going to be way more difficult than you think. Like, you're not going to be as ready as you think. So you need to be open and you need to like try to prepare yourself. And I think my transition into undergraduate school was a little like was not as difficult as I expected. So I think I had the same mindset going into graduate school. I was like, okay, it's going to be like a little bit new, but should be fine. But my master's degree is a course-based master's degree as well. So it starts as a course-based master's degree and then it moves on to having an actual project. So our project only runs for 1 year. So it's called the capstone. So starting on course-based work and working in translational research, we have a very different, we open up a very different door than what you would have seen going from a transition between high school and university, because throughout university, chances are first year you go over the things for a little bit at least of what you learned in high school, and then you build on that. But because I was going to something that was so different and it's already very new as well, so there are a lot of different ways to look at it, because it's pretty abstract as well. It was very overwhelming, and that did take a toll on my mental health overall. I didn't know if I was doing the right thing. I thought, you know, like I had chosen this program pretty quickly. I wasn't 100% sure, like if grad school was the right place for me. And then like it kept piling on and piling on because we had to work on a lot of different projects, like mini projects at the same time. And I think for a little while, like we have a framework of how to go through projects. So the framework just wasn't clicking with my brain. Like I already had 4 years looking at science in one way, and they were trying to fix it or change it in like the next 6 months. So it was really difficult. And I think I didn't really even get over that until I think that nearing the middle to end of second semester. And only then was I like able to feel like I could really rely on the people around me, because I thought, you know, everyone else is doing fine and I'm the only one that's like really struggling, or like only the few people around me that have told me they're struggling, like it's only us and everyone else is doing fine. And I think there was one night we all went to a pub or a bar or something, and we just all kind of just de-shedded every single like problem that we've had throughout the entire like year. And it was something that I really wish we had done before. So like getting to know more of the people and getting to like really get them to become a support system for me. Because of course, like I had my family around me, I had some of my friends that weren't in the same program, but it's pretty difficult to explain what grad school is if you're not in grad school. So then they could support me, but they couldn't really relate. Whereas, you know, my fellow students could easily relate. They could, and if they weren't relating, then they could actually help me with some of the problems that I was going through. And I think it's also, it's very humbling to be able to not only tell someone about what you're going through, but accepting the help that they're willing to give you, because in master's degree as well, not everyone's going to be the same age as you. So it's, you're working with people who might be younger than you and might be like a lot older than you. And like these people might have clinical experience that you don't have. They might have actual business experience in my program, especially. So having like such a broad range of people open to you to actually speak to them, it's something that like I would like really recommend looking into and like finding out who is in your program and like who can help you, especially when it comes to talking to students. And then on top of that, talking to your professors as well. But yeah, like having someone at the same level as you and having like an equal playing field, it makes it way more comfortable to talk to. Like it might be difficult to talk to a professor. And yeah, so, but that's like basically the reason why my current project, which I didn't mention before, it's on the mental health of graduate students, and we're looking into how we can either improve on the resources that we have or create an entirely new resource that actually focuses on the needs of, you know, my fellow peers. So.
That's amazing. Thank you so much. I definitely relate when you say that it's hard to explain grad school to people who aren't in it. And yeah, based on all our nods, I think that the other panelists would agree too. And it's super cool that you kind of came full circle, and now that you're kind of working on something that like would have been awesome to be if it was there like when you were coming in too and stuff like that. So thank you. I'll pass it on to you, Sophie, now.
Sure. I would identify kind of two large challenges that I had in grad school. So one of them was the fact that I was doing school in Toronto and then working in Yellowknife, and I felt like that presented a pretty large challenge for me because I was trying to balance not only the expectations of the university with doing community-based work, which is itself presents a lot of challenges, but also just like the logistics of trying to go back and forth and make sure, because I was really wanting to be in Yellowknife so that I could really kind of build and maintain close relationships with community partners there. But then, of course, for coursework and for other kind of PhD related activities, I was back in Toronto. And so that was for me a big, I mean, it was a challenge. I think for that, I really learned a lot about making sure that I have what I need to kind of take care of myself, make sure that I'm kind of clear with other people about where I'm going to be and when, and being really organized in terms of like setting up the project. And I was really also very fortunate that I had that I was working with this research institute throughout in Yellowknife. And so that was another way that I was always kind of staying connected with people in the community. And then the other challenge I would say was mental health. Exactly. I think that for me, that I think sometimes I felt isolated in the program I was in or overwhelmed, and really resonated with what was said about like not sure if I was doing it right. I wasn't really clear what the expectations were, but it was clear if you weren't doing it properly in some ways. So and just also, it kind of felt like when I was writing my thesis, like I was creating, I mean, not to like boost myself up so much, but like creating a piece of art or something, like you're creating something creative, writing something, and then you're showing it to people. And it's such a vulnerable experience too. And then, so I really like, yeah, I learned a lot about myself through that process, like personally and professionally. And I think it's wonderful. The Radica is like you're taking your experience and like trying to create supports for other students, because I really think it's needed. that kind of
I just want to say thank you for that. That's very sweet.
yeah. Like I'm so grateful to my family and my friends who kept me going in the process. And also for me, COVID hit in the middle of my PhD program, and I don't know if I would have finished if I wasn't doing a community-based project. It was really like my relationships with community members that kept me going. And I'm really, really grateful to them. So stop there.
Thanks, Sophie. Yeah, it's just, I can't imagine how much back and forth you must have done. And like Yellowknife and Toronto are very far apart from each other. So yeah, it must have been a challenge over the years. But thank you for sharing. And yeah, I'll pass it on to Aida.
Yeah, thank you so much. I definitely empathize with both Sophie and Radhika on your experiences, because I remember having that same conversation with my friends and they were asking, "Oh, what's your thesis about?" And I'm like, "Oh shit, like how do I define this to my friends who are not in the same program, right?" And it's like, okay, I had to really use so many real life examples to compare things. And that's what I found helped. It still helps to this day. Even when I'm explaining to like a bigger group of people, even within my professional career, as a project manager with Mackenzie Health and the Ontario Health teams, when I explain my thesis to my coworkers there, I still have to use those examples to kind of clarify certain things. And I found one of the, adding on to what Sophie and Radhika mentioned about the challenges faced in grad school, I found that for thesis students in particular, there wasn't a lot of support for job hunting, right? Like we were just mostly left on our own to kind of do our own thing. And I think that if you're paying so much money for a master's program, you should be getting your worth, your time and your money invested into something that will be sustainable in the long term. And while I'm grateful for a lot of the things that I've done in my master's program and for a few of my professors and what they've taught me and the connections that I've made, and being a part of the Global Health Annual Review Journal now as part of the editorial team there, I quickly came to realize that I have a voice and I'm going to use it, right? We have a position of authority being students. It's there, we have it. So we need to be able to use it to advocate for those who don't have that privilege, right? And be able to advocate for something that is going to translate into an actionable item much later on. So that's what I did. I rallied up my my co-editor-in-chief at the my editor-in-chief at the time. Back then I was just an editor. And her and I went to the Global Health Office at the McMaster University and we voiced our concerns. We said, hey, listen, this is what's happening right now. We're not just the only ones that feel this way. There are a few other students, actually quite a bit amount of students who do feel that, you know, the program isn't being as supportive with its capacity to support as it should. And this is what things should be done later on. And I think I encourage everybody on this call and those who are listening on, if you see a problem with your program, obviously voice it within reason. There's ways to do it, right? But at the same time, don't remain quiet. Because the more you let it sit and it presses on, it's not going to go anywhere. And I noticed that even now in my own career, like the master's program in particular gave me the analytical tools to see problems, but it didn't give me the solutions to solve that, right? I came up with my own plan to kind of amass solutions and problem solve together within my own teams in jobs that I had in the past, and research teams that I was in a part of in the past, with colleagues that I now work with, right? With connections that I've made after my master's program, doing those hunts on LinkedIn and really just putting your time on and effort into sending those cold messages and those cold emails and really making sure you're targeting the jobs and the specifications that you want to be able to match. That's what got me the position that I have right now, right? And throughout this time, for me it was a bit tumultuous because of the fact that my father also had a stroke, and I had to switch my entire gears in what my research was going to look like. Initially I wanted to do a proper study. It was going to have a research ethics approval, everything like that. but because of the circumstances, I had to switch into a systematic review. So I can be able to finish within that time and then be able to get a job to support my family and be able to support myself in the process, right? So my situation is not unique, right? There are a lot of other grad students that go through very similar challenges all across the world, right? Even worse at that. And I'm really grateful for the opportunity to have been through this program, because if I wasn't in the program, I wouldn't have been able to come to this panel today and share with you the lessons that I've learned, and to be able to empathize with what Radhika and Sophie have presented as well. So 2 challenges. The first thing being the lack of support from the institution that I was in, specifically for thesis students to get a job. And secondly, just that personal challenge, having to switch gears.
Thank you so much. Yeah, you touched on so many things, and we could honestly dive into it a lot. But overall, I'm grateful also that you are here on this panel today to share your insights. So thanks, Aida. Okay, I'll pass it back to Sapir now for our 3rd question.
So our 3rd question is, what does it mean to decolonize global health? And in what ways have you engaged with decolonization? You can either focus on your research or on your coursework. So Radhika, do you want to answer that question first?
Yeah, so the first time I saw this like this question or this term of like decolonization, I definitely was a little bit confused. But from what I've understood from it is kind of like, and please correct me if I'm wrong, kind of like making healthcare the center field, but also reaching out and creating a broad spectrum of which fields are included as we learn more about healthcare and as we try to do more research. Yeah, I'm seeing the nods. Okay, that's great. So yeah, I think honestly it works incredibly well with what I've been learning through my entire translational research program. It's something that I didn't realize we needed until I started this program, because from what I understood about research previously, I was like, oh, like people they already know about the needs. I don't know how they found them, but like clearly they already know about the needs. They've done their work. And now they're just creating hypotheses to continue figuring out different solutions and things. Obviously, is at a very small scale when we were looking into like obviously molecular medicine is a very small scale. You're looking at proteins, you're looking at genes, things like that. But I was like, yeah, of course, like this is going to help someone someday. But I didn't realize how narrow the view was really when you're looking into laboratory sciences. And that's one of the things that I was very like, I wasn't against, but it just wasn't complementary to my skills that I felt like I had. And I felt like I wasn't actually challenging myself enough going through that. But as I've kind of grown through this program, one of the worst and best ways to grow is definitely through challenges. And going through that learning curve, I now never try to find a solution right away. I'm always trying to ask questions as the first thing I do is try to ask questions. As many things I can learn about the problem, that's my first way to go. And there are things that like I feel that have maybe like proficient or advanced knowledge on, if it has to do with something in my background or something personal that relates to me. So if someone asks me about my research project, I clearly have a good idea of what my research project is about. But then if someone was to ask me like about the implementation of a mental health resource right now, we're speaking to marketing strategists, we're speaking to health and wellness at U of T, and we're speaking to professors to see if involving the faculty is possible. There are so many, and this is on top of speaking to graduate students already. So there's so many different arms to reach out to when you think about how to actually bring a solution or an intervention to light. And I think that's something that has been missing for quite some time, because as I've learned looking back and like reflecting on what I was learning in my undergraduate degree, it was very much like, oh, you know, this person mentioned in their limitations section on their one very specific research paper that they didn't do this one thing with the gene that they were looking at. So we're going to do that one thing and see what happens. And it's very like almost observatory rather than actually like pushing things forward. And maybe that's just because I prefer clinical work. But like, and it's not that this work isn't important, but it kind of, you're pushing the patient further and further away as we kind of work through this. So I think decolonization overall, it not only forces a person to reflect on the different arms and different fields that can be used, that can be useful to medicine, and kind of removes the cylinder around medicine, like the silo that medicine lives in. And then it also keeps the patient very more firmly in mind. And kind of, if anything, rather than centralizing healthcare, we're centralizing the patient themselves.
Thank you so much for sharing. I think two really important things that you brought up was firstly, asking questions. So asking the community members or the people that you're doing research on what they want to see out of the research. And the second thing that you mentioned was involving multiple stakeholders and having those partnerships with community organizations or community members. So those were really two important things that need to be further discussed when we're talking about decolonization. So thank you so much. Sophie, would you like to answer this
Absolutely.
question?
Sure. So when I think about decolonizing, and I like to use the word decolonizing rather than like decolonization or something, because I think about it as a verb. It's an action that we're always working towards and it's ongoing. Because I work really closely with Indigenous communities, I think about how historically research has been done on Indigenous communities. There's been very extractive researchers coming in, taking the information they need, leaving, and then not reporting back on what's shared, and just really doing a lot of unethical work. And so when I think about doing research differently, it's really about working with people throughout all stages of the project, and even ideally having community lead and drive the research itself. And a key point that I also think about is ensuring that communities have autonomy and sovereignty and control, ownership over the data, how it's used, what's examined, how it's analyzed, who's involved, how is it governed, like all of these large questions that determine what the research is going to look like. And also in working with Indigenous communities, really recognizing that you can't take a pan-Indigenous approach. It has to be distinct. You have to work with each community. What that looks like, what research looks like is going to look different depending on the community and what they want, the type of work that they want to see. So I think a good example is when I was working in my second year of my PhD, I worked on a project with the CAGH government in the Northwest Territories, and we developed a community-based research training program for CAGH government employees. And then they were starting to do some research around opioid use in the communities. And what was really amazing about that project and why it was so successful is because the CAGH government was leading every stage of it and had control over every single part. So there's a lot of good work that's being done out there, and I think shows that it is possible and that we have to kind of let go of these old and outdated practices.
And thank you so much. It's really interesting to hear your perspectives because you've worked so closely with these Indigenous communities for so many years. And it's really interesting how you noted that not every Indigenous community is the same, because I feel like oftentimes in media or even in schools, they talk about Indigenous being everyone's the same and having those same stereotypes. So thank you so much. Ida, would you like to answer this question?
For sure. Thank you very much. Before I actually answer, what I'm going to do is I just found a really cool definition explanation of decolonization. I just plugged it in the chat by Queen's University Center of Teaching and Learning. And one thing I want to highlight from this particular definition is there's a paragraph in there that says Canada's identity as a settler colonial state complicates the task of decolonization. Since the original colonizers never left, and since acts of colonization continue to be present. So, for instance, I know Sophie can relate to this. In Canada, settler colonialism is evident in federal and government policies such as the Indian Act and the Indian residential school system, provincial government child welfare, and decisions regarding that too. And as well as non-Indigenous peoples' refusal, either blatant or subtle, to give up land or acknowledge the land and treaty rights of Indigenous people, right? So based on that definition, and based on the work that I've done and what I've studied throughout my master's program, my undergraduate career on colonialism, I'm quite over the term decolonization. I personally don't feel like that's ever going to be possible just because of that particular paragraph I just mentioned. And then Canada not only is the only settler colonial state, there are many settler colonial states across the world, if not all of them, right? So it's quite impossible for us to decolonize. But should that stop us from understanding the elements and the procedures of what decolonization should ideally look like? I don't think so, right? I personally feel as though there are certain deliverables that we can meet to be able to achieve the true meaning behind equity, diversity, and inclusion. That's another phrase I'm quite over as well. But I I will say that there are ways to be able to analyze and critically assess action items and deliverables coming out of these definitions, right? What we all need to do is to achieve consensus. And achieving consensus on that is very difficult to do, right? So decolonization sounds very flowery and very nice. That's something that we want to work toward. It's not achievable. I personally don't feel like it ever will be achievable. But it's not going to stop me from looking at the procedures and looking at the guiding principles behind it and seeing which of those are actually achievable. So I hope that answers that question.
Thank you so much. And thank you so much for also sharing the resource. I'm sure the attendees will really appreciate it as well. Just a reminder to everyone who's watching the panel to please share any questions you may have in the chat, and we will be answering any questions at the end.
Thanks, Sapphire. And now for our final question already. I feel like the time has just flown by. I've been so interested in everything that you guys have to share. But for the last question, we wanted to ask you, what would you tell your younger self in undergrad? So we've gone through this whole journey of like choosing the program, the challenges, and just like going through it. But looking back now, what's one thing that, yeah, you wish that your undergrad self had known or had some insight to? Yeah, so to get us started, I'll pass it on to you, Radhika.
I'm just going to say that I'm really happy I went first for that previous question because I definitely took it in a little bit more of an abstract way. And I think I would have been kind of stressed out to bring up my abstract thought after. But like you guys have brought up some really great points, and honestly, I really appreciate the solid debate ground that you've landed on. I think that's really great. We don't get that as often, and it does spike some more interest in my opinion. But yeah, to talk about what I wish I'd known before, or like what I wish I did, or what advice I would give myself in undergrad, I would definitely give myself the advice of try to learn more than just like what is in your degree. Because I think there are a lot of things I missed out on. Not missed out, I don't want to say missed out. I learned a lot of things in my degree, but they were very focused in on obviously like science. I was learning about medicine, I was learning about anatomy and like all of these different things that had to relate to like biology and molecular medicine, because obviously like that is my That was my degree and it makes sense. But at the same time, I feel like I could have used my like any opportunities I had to kind of stretch myself a little bit further away. And, like recently I've gotten an interest um into investments and how like the stock market works and things like that. Like, and I have kind of gotten these interests through like docudramas, so like movies that are made off of real experiences. And I think those things, the movie called The Big Short, I don't know if you guys watched it. It came out in 2015. It was about the market crash in 2008. And that kind of thing, they bring up all sorts of wordings that you will not know anything about. So actually like going forward and like looking into all of these different factors, like I've learned a lot just from like getting points from that movie. And that's just one example of like the different things I've learned. I've learned a lot more about psychology through different movies and like these like the type of essentially what I'm saying is if I could go back and actually do more and like kind of get a little bit further out of my comfort zone when it comes to learning. I think I would have had maybe a more difficult time in undergrad, but I think I would have come out of undergrad having a bit more of a well-rounded experience. And when I thought they said well-rounded experiences, I was like, oh yeah, I'm volunteering in like different places and I have a job in like a geriatric hospital. I have a volunteer position in a different field of medicine, but I think like there's definitely a way to reach out even further. And it is hard to see it at the time. Like obviously you're looking at like I have midterms, I have exams, and like I think even doing it from that watching a movie, the spikes of interest, and not just rewatching the same movies over and over again, which is something I definitely do. Getting a little further out and watching a movie that you think you would have never really had an interest in. It's like 2 hours of your life, and if it doesn't end up being something that's interesting to you, you've still kind of given it a chance. But if it does, you never know what will come next after that. So
Thanks, Radhika. Sophie, I'll pass it to you.
Sure. I love that suggestion of just kind of trying to stretch yourself and push yourself outside your comfort zone. I kind of want to build on that, I guess. What I would tell my younger self is to really try to learn from every experience. So when you do push yourself and let's say it falls flat or you do great or something, whatever it is, to really try to remember to reflect, because sometimes like it can go quickly or you can kind of forget that something happened, and really trying to learn from every and see everything as a learning opportunity. So like even if you're doing it, maybe you've never done it before, great, it's a way to learn. And I feel like I didn't start having that attitude until I was later on in my PhD, and I wish I had it earlier. And so that's what I would advise others.
Thank you, Sophie. And Aida, I'll pass it to you now.
For sure. Thank you so much. Just echoing off of what Radhika and Sophie mentioned as well. A lot of the things that happened in my undergraduate career was not within my control. And I'm a firm believer of God has a plan for you and everything happens for a reason. So I would just tell my younger self, keep having that, in Arabic, we call it tawakkul. So tawakkul meaning firm, grounded belief and trust in God that things will work out the way that it should. So I would tell my younger self to keep having that. Additionally, I would also tell my younger self to don't be afraid to step out of that comfort zone and learn how to network yourself in different spaces. So definitely echoing of what Radhika and Sophie mentioned, see everything as a learning opportunity. Put yourselves out of that comfort zone, right? Use the networking platforms that are available to you. So it doesn't have to just be, attending events. It can also look like going on LinkedIn, going on any other social media platform and presenting a full profile of who you are and where you want to be, right? That last part is very important. Where you want to be, what kind of like career professional do you want to become, right? How do you envision using your personal experiences into the work that you want to do, right? Because all of us have a personal invested interest in what we're doing right now, Otherwise, we wouldn't be here, right? So it's all about, okay, don't be afraid to share what those personal experiences are, because folks tend not to do that. They tend to steer away from showcasing, okay, you know, this is why I'm here. I have a personal health challenge, that's why I'm here. My family has a personal health challenge, or et cetera, right? And those are the things, those stories are what engage folks to want to work with you. And that was a barrier I had to overcome in my master's program. I was like, okay, people don't want to hear about the fact that my mom had a breast cancer and stuff. That had nothing to do with this career, but it does. It's a personal vested interest, right? Don't be afraid to do that in professional spaces, right? Because it's those stories are what push people to do the work that they do right now. Thank you.
Thank you. That's so powerful. And thank you to all of you guys. Like, I wish my undergrad self knew you guys now, and then I'd be well better off. And yeah, okay. Well, thank you to all our panelists just in general for all the questions. That was our last one. We do have one question in the chat from Amy, and it reads, what would each of you say are some of the most prominent topics in global health research recently? It's okay if answers are broad. I'm interested in any insight. So maybe we could do a little bit popcorn style, like if anyone has like has something to say right away, or if it's, yeah. Would anyone like to go first?
I can start off, actually. I'll touch upon that earlier point about the legal determinants of health. That kind of came out from my particular research a little bit. So I'm going to plug an article from the Lancet in the chat. So that's one there on the legal determinants of health. There's another topic here I just attended a webinar on the commercial determinants of health. That's another research topic that I feel is worthwhile looking into. So another one would be, I just plugged it in there, the commercial determinants of health. So those two things are very, very coming up now in terms of the world discussion in a lot of these diplomatic environments regarding global health research. So I'm 100% down to have a further conversation on these two, on whatever knowledge that I have currently. I can definitely speak on the legal determinants a bit more and more in my thesis work in another webinar, or privately. Amy, if you would like to reach out to me, I'm more than happy to have a discussion with you.
Thank you, Aida. Sophia or Radhika, do you guys have any thoughts that you would like to share?
I'm less familiar with the global health space, but I know that certain areas that I've heard a lot about are like planetary health. You know, climate change is impacting us all, like all beings, in dramatic ways. And I think that including food security and new health issues and the impacts on the environment. So to me, that's a huge area for further research.
I also I like both those. I don't think I've done much research into either of those things, so those are definitely sparked interest in me. But I obviously have my project that is based in mental health. And I don't know if that's changing the algorithms on my computer or if it's actually becoming more of a prominent topic, but I believe that it has been, and it's something that it's developing quite quickly. I think people are realizing and being more accepting of the fact that, you know, not everything is okay, and that needs to change because the resources that we have are outdated. We're not taking advantage of the technology that we have. And sometimes when we are taking advantage of it, it's not working, and we need to understand why. And so these types of things, like, we're learning a lot more about how these like symptoms can present themselves. They're very different for everyone. Like I don't know if anyone's heard of like how ADHD is actually being like not discovered, but like it develops in women very differently than it develops in men, or I'm gonna say like females versus males. And it's like that in and of itself is already looking at how potentially the patriarchy has been shifting the way that we've been looking at healthcare in general. So things like that. Another thing I was going to bring up was AI. Artificial intelligence is coming to be very, very much more broad than we expected it to be. It's definitely touching upon a lot of different places. So I've heard a lot about it in surgery. I'm actually currently doing a scoping review on perspectives of AI. And that has brought up a lot of different topics on like where it can be used, if it should be used, looking at the ethics of it, and how people really feel about it, and whether or not it's like, is it actually a proper intervention that people want, or is it a intervention that may not be doing the right thing? That like, because there's a spectrum of where people are, as to whether or not they appreciate it or whether or not they're absolutely terrified of the work it can do. And I had a third one, but I cannot remember. So those are probably my like top two things that I've been looking into recently.
Thanks, Radhika. Amy, I hope you are very inspired now by the many different topics that you could consider. We have another quick question in the chat. It's from Nafi. It asks, if you had one suggestion for improving the impact of networks like the CAGH Students and Young Professional Network, what would it be? A little bit more broad / specific, but I'm not sure if anyone has any. I'd like to go first. Yeah.
I'll go first. Yeah. I actually made this comment earlier when we were doing our tech check. Just making this particular event more accessible, more open to the public, and not have it just members only. I think a lot of people could benefit from this conversation, and it shouldn't just be reduced to just members alone of the CAGH. I think the network and Students and Young Professionals Network is established in itself. It's great. I love the work that you guys are doing, but making this event more accessible, more open, in person and virtually, would be much better.
Thanks, Aida.
I think that would be super fun if this was like an in-person panel. 100% agree. But yeah, it would be really great to meet all of you as well. But I would also say, like I mentioned it way earlier, but like we were looking into marketing strategies through actual like business models rather than just like kind of using what's been used in current healthcare and university marketing. So actually like getting some consultation on ways to do that. And like even properly using Instagram, like that's something that I didn't realize that I wasn't doing properly for this, and it's really been helpful. And yeah, so that could be something. And I would love to come to a conference for CAGH 100%.
Thanks, Radhika. I'll keep you in mind for the next invite for the in-person thing. Okay, I think that is the end of our panel. So we don't have any more questions in the chat. Yeah, so thank you again so much for our panelists and for the audience members and everyone who came and listened. If you have any questions, please feel free to contact us and we'll get you in touch with our panelists if you had anything else that you would like to talk about. And yeah, with that, I'll pass it to Sapphire for any last words, if you have any.
I just wanted to say thank you so much for all the panelists. I learned so much, and I hope so did our audience members. And I hope everyone has a wonderful day.
Thank you so much for having us. It's been great today.
Likewise, really appreciative.